Okay, so this is Mr. Gomez. He's a 68-year-old male. He came into the ED with his daughter, who brought him in. She found him unresponsive on the floor of his home. They decided that it was a COPD exacerbation. He does have a history of COPD. They did a chest x-ray and they found like a weird area of density, like abnormal area of density in his left lung base. So they decided that he had pneumonia. So we started him on ceftriaxone, and he had an allergic response to that. He started itching pretty bad. So we discontinued it and started him on levofloxacin. He is allergic to ampicillin, so that could be why he had that allergic reaction. We started him out on 5 liters of oxygen this morning. That's what he came to the floor with. And his oxygen saturation went up to 94%, which is normally good, but for him it was too much. And so his level of consciousness kind of started to go down. So we put him down to 2 liters of oxygen. His oxygen saturation went back to 91%, and he's been good on 2 liters ever since. So he is alert and oriented. His lungs sound pretty good. There's some wheezes and crackles, but hopefully that's just because of all the mucus he's got in there. He has a saline lock in his left wrist and it does flush. His daughter has been at bedside frequently throughout the day. She is concerned that he's been smoking and drinking too much. That was brought to our attention earlier, and also with his diet. She thinks that he's been losing weight, and his prealbumin was actually pretty low as well. But the doctor wants him to do a soft food diet to help him eat a little more so he doesn't get as worn out. He had another chest x-ray this afternoon, and they decided that it was a pleural effusion on the left side, and they gave him a chest tube with a water seal, and they want him to do incentive spirometry every hour while he's awake, cough and deep breathe every hour while he's awake, and they also want him to get up to chairs with all his meals. And yeah, he has not much else. No diet restrictions, just a soft food diet. He needs lots of fluids. He's going to need a home health consult because he does live alone. Yeah, so do you have any questions for me?